Hello, I am particularly excited to be able to bring you the protocols in Tired of Being Tired. These are basic protocols, and these are very dear to my heart because over the last 13 years that I've been in the integrative field of medicine and teaching and seeing patients, I've managed to have to deal with this particular issue myself on 2 different occasions over the last 13 years. And of course, each time I've learned more and more about how to get myself to the point where I have my best life in front of me and I feel radiant, vibrant, and healthy. This particular webinar is part of MD Prescriptive's educational series, which you can find at mdprescriptives.com, and you can find it also at sejun.com. So let's get started. First of all, thank you for taking the time to be on this webinar. Obviously, it takes time for us to learn, and I'm sure that the material I will share over the next 30 minutes is going to be very useful in your practice. That's my visualization of me at my peak, vibrant, radiant self. So the natural instincts are best observed through the animal world. When you look at the animal world, what you notice is that the animals sleep when they're tired. Those happen to be 4 of my 5 dogs. Eat when they're hungry. And this natural instinct also prevails in the human infant. Even ancient practices were intuitive in nature and healed through regeneration. Whether you look at the Chinese, Eastern medicine, Greek, all of them were focused on healing through regeneration and respecting the power and the message that nature gives us. We've now gotten to the point, of course, that pharmacy and surgery are playing a major role in what we do when we need healing. And this evolved over time to the point where we have excluded many of the restorative and regenerative mechanisms that we once had available. A great example of this is when you look at the #1 complaint in the United States, which in my practice is fatigue. And our approach to this is not necessarily instinctual. It actually, we are using things like energy drinks and coffee. And this is actually a Red Bull machine that says refuel yourself at the gas station. Energy drinks have become the #1 growing drink industry in the United States. Instead of a simple solution like just taking a nap when we're tired. In fact, if you look, the majority of the world naps. And if you look at the blue zones on the earth, the blue zones on the earth respect the fact that our sleep cycle is a diurnal sleep cycle. It is not once in 24 hours, but rather twice in 24 hours. This was proved in 2003 when Harvard Medical School published data showing that a nap improves memory, problem-solving, creative thinking, focus, and performance, and learning. As a matter of fact, at that time, the majority of the Fortune 500 companies ended up adding a nap room. So for any of us who think that a nap is a bad thing, I would tell you that a nap is a natural instinct, and feeling tired in the afternoon is a natural instinct, which in our society we often fight off. The most important thing to taking a good nap is planning it and not feeling guilty. So obviously, that's one of the things I recommend for people who are feeling fatigue, and I also recommend it for anybody who isn't feeling fatigue. Looking for the cause. This is where the answer in restorative regenerative medicine comes from. And whether you call it functional, regenerative, or restorative, we're really talking about an approach that enhances our ability to find the underlying imbalances that cause symptoms such as weight gain, sleep disturbance, tiredness, anxiety, and headaches, and causes things like diseases of the musculoskeletal system, neurological system, blood vessels, and organs. And these underlying imbalances can be identified if one looks at the fuel tank, and the fuel tank consists of hormones and nutrients, to be simple. When we're talking about hormones and nutrients, we're talking about not being between the 10th and the 90th percentile, which is considered to be the normal range, but we're talking about being above the 75th percentile, which is the protective range. As an example, vitamin D between 30 and 100 ends up being a normal range, but above 70, we drop the cancer, the dementia, and the heart attack rate by almost 50%. The third area to look for imbalances is our ability to get rid of toxins. And the most important piece there is going to be the fluid we flush the body with and the pH of the body. And then comes the subconscious and conscious mind and the physical body. We know well that the subconscious controls 90% of our health, and it plays a tune. And by reprogramming that tune, we're able to have the best of our life in front of us. When we're talking about optimal values, this becomes illustrated by just looking at this slide, where DHEAS is normal between 45 and 400. Whereas if you look in the morning, you really expect to be in the upper quartile, which would be at least above 200. And that means you're starting off with a full tank on the cortisol adrenal pathway. By the evening, it would be almost 100. If you're starting your morning off at 100, you got an issue with fuel in the morning and you are running on fumes. So the optimal levels are always in the upper end. Luckily, the literature that supports these mechanisms doesn't come from anecdotes. It comes from solid references, and more importantly, my experience that I've had in the practice over the last 12 years and over 11,000 patients, treating many of these conditions and having over a 90% result with patients also coming off of psychiatric meds and pain meds and sleep aids and reflux medications. So let's talk a little bit about how each one of these causes and impacts our energy and what we can do about it. We are very aware that pain and physical activity need fuel. When there is pain, neurons fire to respond using magnesium, B12, DHEA, and cortisol. Similarly, when we exercise with our heart rate above 120, we know that we are using the fuel. Keeping our heart rate under 120 allows us to use less fuel. So physical stress, such as pain or activity, depletes the body's reserve of nutrients and hormones. Similarly, mental stressors do the same thing, whether they come from the subconscious, which is 90%, or they come from the conscious mind. Because every cell in our body is eavesdropping on our thoughts. In fact, we have found that our thoughts equal neuropeptides. In New York University, and if you look at Bruce Lipton's Biology of Belief, it becomes clear that the thought process, I have my best life in front of me, I'm going to be cancer-free, I don't have fibromyalgia, has a whole set of neuropeptides that stimulate the immune system and the body, compared with the thought, maybe not. So just by steering our conscious and subconscious thoughts, we control a big bit of this internally. The second part is that we are aware of a tiny fraction because we control only a tiny part of our conscious thoughts. And this was said by Barry Gordon at Johns Hopkins University. Externally, we know that the news, the phone buzzing, the traffic, the noise, the commitments, the people, the drama, each one of this creates a stimulation that increases the beta waves and therefore the utilization of hormones and nutrients in the body. So when we have people coming in and saying, well, I want my hormones balanced, or I want my nutrition balanced, the answer is that you can pour hormones and nutrition into the fuel tank. Simultaneously, you must also decrease the speed of the engine, which comes from physical and mental stressors, so that you don't have a hole at the bottom of the bucket. And that simply means that hormone balance means life balance. Otherwise, you will continue to pour hormones in and nutrients in, but the speed of the engine is running faster than it can take. So mental and physical stressors deplete the body's reserves of nutrients and hormones. The basic toolbox, therefore, has sets of ingredients that fall under each component. Physically, we ask people to lower the exercise intensity, and for a lot of people that comes as a surprise, because when they're complaining of low energy, they actually expect you to say, oh, well, if you exercise a little bit, you'll feel better. And their story usually is, when I exercise, I feel worse. Raising the oxygen concentration, either through different kinds of breath mechanisms or heart math, which I'll be teaching you, yoga, tai chi, massage. In terms of the mind, similarly, heart-focused breath, hypnosis, coherence therapy, and personal choices that allow us to put our energies and our fuel tank where it makes sense. The control of the amount of fuel that's used on the heart rate variability in the mind became rather easy when we realized that actually it isn't the brain that's controlling the heart. It's the heart that's controlling the brain. In fact, 90% of the neurological signals go towards the brain from the heart, as opposed to the 10% of signals that comes from the brain. This gives us great power, knowing that the heart controls the brain, simply because we always thought that we would have to do meditation at the level of the mind in order to bring the nervous system down. But it turns out that we can work at the level of the heart and do it a lot quicker. For example, heart rate variability that sits on the red line, which is an incoherent pattern of frustration, anxiety, worry, and irritation, impairs performance and uses more nutrients and hormones, compared to the beautiful blue sine wave you see below, which is a coherent pattern with positive emotions, appreciation, love, and care. You can bring yourself from the top pattern to the bottom pattern within 30 to 60 minutes of meditation. You can also bring it there within 3 to 5 minutes, even 30 seconds of heart-focused breathing. This becomes powerful because this has been a major way for me to teach my patients quickly to use a tool that can quickly shift them and quickly reduce the use of hormones and nutrients, and simultaneously improve the coherent communications with the rest of the world. Because when you're in a sine wave, you influence the people around you. And when you're not, you influence the people around you. The quick coherence technique involves 3 steps. The first one is a heart focus, focusing the attention to the area around the heart and the area in the center of the chest. Step 2 is breathing deeply but normally, and feel as if your breath is coming in and out through the heart area. And I would try this while I'm going through this today in the webinar. It's a very powerful mechanism. And step 3 would be to regenerate the heart focus and heart breathing while you regenerate a positive feeling, a positive memory. If you're at the beach, close your eyes. What does it feel like? What does it look like, sound like, smell like? And within 30 to 60 seconds, you're in that blue pattern. If you want to read more about the 2 decades of data around this technique, go to heartmath.org and realize that after the data came out on this technique, Many of the Fortune 500 companies and many of the colleges around the United States are requiring their students and their top CEO and executives to learn this technique because it's so quick and has such a big influence. It influences long-term memory, short-term memory, focus, reaction times, processing, test scores, ability to learn, and more. So this is a powerful technique that I use mostly because it also decreases our doses of hormones because the nervous system is running a lot slower. We are using this technique to reprogram many chronic conditions and patterns, such as depression, anxiety, pain, fatigue, smoking. Most of these things actually lie in the subconscious, and when we start to breathe in and out of our heart with a heart-focused method, we're able to correct these things. So the basic toolbox includes these two things. Let's go to see what we're doing with hormones. Obviously, we know that hormonal depletion plays a large part in tiredness. And of course, it has to do with the speed of the engine. The very first hormone that's going to go is cortisol from the adrenals. This in turn knocks down thyroid activity because it downregulates the thyroid receptor. And third comes the sex hormones, which can feed the adrenal pathway as needed. So although many times when we're talking about hormone replacement, we're talking about giving estrogen, progesterone, testosterone, ultimately these hormones are feeding the adrenal pathway because they're on the steroid pathway of cortisol. Cortisol is produced in the body at about 20 milligrams per day. Its major function is in stress response as it regulates the production of catecholamines. When you look at the steroidal pathway, it becomes clear that cholesterol turns into pregnenolone, then progesterone, DHEA, testosterone, estrogen, and all of them can shunt towards the cortisol pathway, which is exactly what happens when we're under stress and we are not having a proper cortisol response. You could see the shutdown of all this. You could see premature ovarian failure, irregular periods, tiredness, any symptom that correlates to any of these hormones because they are lowering their production and being shunted towards the cortisol system. The normal stress response involves an acute stimulus that produces a cortisol response, recovery, and preparation for the next stimulus. The chronic response, which leads to adrenal insufficiency, involves an acute response and no recovery until finally the adrenal just cannot respond to the next stressor. This system, if you look at the serum, starts to get identified first on the DHEA pathway, and I find many times people get confused when they look at the serum and see the cortisol to be high, but the DHEA to be low. The DHEA generally drops before the cortisol, and although this pathway shows pregnenolone holding its own till late in the game, my experience has been that you cannot predict where you're going to see it on the pathway because it has a lot to do with what enzymes you have. So very often I see pregnenolone falling before DHEA, and you just have to keep an idea that you have to look at every precursor on the cortisol pathway, which includes pregnenolone and DHEA-S, the sulfated form, and progesterone. And in the morning, you're looking for the upper quartile to start with. The cortisol itself goes up and down, not very reliable. So basically, this deficiency leads to a syndrome with fatigue, which is also called adrenal insufficiency. In the literature, I'm starting to see hypocortisolism, and it's either caused by adrenal dysfunction or by a hypoactive pituitary response, which is to chronic stress. Symptoms you see are things like being tired, and of course not following our natural instinct to sleep, pain from the loss of hormones. When you see people go to their doctor and start getting injections on the neck and the shoulder and the hips and the joints for cortisol, think to yourself, why? And the why is always going to be that they're just not making enough cortisol. So that becomes critically important when you treat these patients because In addition to the injection, we should be looking at how to promote their cortisol pathway. Being overwhelmed by things that normally wouldn't overwhelm you, having hives and allergies and rashes as a consequence of mast cell instability in the gut and low cortisol, which usually suppresses this response. And this is why I generally do not allergy test until I get the adrenals right and until the gastric system is completely corrected, because otherwise they're allergic to everything. Salt and sugar cravings, which we should pay attention to. I usually recommend salt, usually 60 to 92 mineral salt, and what we call a caffeine deficiency, which really is trying to pick up the system by caffeine when actually the cortisol is low. Another piece of stress is that instead of saving fluids and minerals, we lose fluids and minerals. And the most important reason is because the chronic ACTH stimulation of the aldosterone pathway ends up being blunted and ends up creating cells that become resistant, and actually we start to lose fluids and minerals. So the major symptoms of deficiency include the afternoon slump, take a nap, joint aches. A lot of people here are diagnosed with fibromyalgia. I do not believe in fibromyalgia. As soon as you start to reverse the deficiencies in each of the 5 areas, the patients completely recover. Being overwhelmed, having multiple allergies or sensitivities, rashes and psoriasis, frequent illness, digestive issues, salt and sugar craving. The major diseases associated include all inflammatory diseases that you can think of, which everything is an inflammatory disease. Most of my patients that come in with premature ovarian failure diagnosis have been completely corrected just using the 5-point model and correcting each part, including management of stress. You always see progesterone symptoms usually as the first. Things like lighter sleep, anxiety, panic attacks, mood swings and irritability, breast cysts, ovarian cysts, fibroids, heavier bleeding, worse PMS. These are the #1 cause for anti-anxiety meds, #1 cause for a hysterectomy, and a #1 cause of bone loss. So progesterone always ends up being the very first thing I use in women. And testosterone can often, or DHEA would be often in men the first thing to use. But we do see more adrenal insufficiency in women, mostly because the reserve is not as high as in men. Cortisol fluctuations also suppress the thyroid. So you're not going to see a patient who has an adrenal issue that hasn't shut off thyroid function by increasing reverse T3 and down-regulating the receptor site. So no matter where they come in terms of their levels, I basically treat all these patients eventually with thyroid. Anyone with excess stress has suppressed thyroid function symptoms, which include low energy, low mental clarity and memory, low focus and concentration, depression, low mood, low motivation, and weight gain, dry hair, dry skin, cold hands, cold feet, hair loss, constipation, loss of outer eyebrows, and LDL elevation. Some people have some symptoms, some people have all symptoms, but everybody has some of these symptoms because thyroid function declines by about 10% a decade. So starting from 30 onwards, everybody's going to have some of these symptoms, and I'm now seeing this even in 20-year-olds simply because we have so much electromagnetic radiation. The major associated conditions will be things like chronic fatigue, infertility, heart failure, bone loss, dementia, low cognition of offspring. So our basic toolbox ends up being using tools to reduce mind and body stressors, correcting the adrenals, the thyroid, and then the sex hormones, and correcting nutrition and toxins. And you could be sure that you would never want to chase toxins in a tired patient first. The very first thing you want to do is load them with fluids, which the body is over 80% water, which means fluids will flush the toxins. And if the pH is correct, they will automatically get rid of toxins. So what I usually do is I focus on the anxiety the sleep and the energy, fill the fuel tank with hormones and nutrition, and when they get to a better place, if there are specific toxins like Lyme or mold or something to chase down, that's the time to chase it down, and that usually happens at 3 to 6 months, never in the beginning. So let's take a couple of cases. This is a 43-year-old complaining of sexual dysfunction, and actually, that's what brought him in. But he also reported financial stress, family illness, waking up every 2 to 3 hours, low energy of 4 out of 10, anxiety of 6 out of 10, with panic attacks. Not a very uncommon scenario these days. And of course, we explained to him what's causing it in terms of the 5-point model, which includes nutrition, hormones, toxins, mind, and body. And of course, although his main complaint was low sex drive, and that's how we explained it, it turns out that the low energy, the sleep, and the various other complaints all fall within the same thing. So fix one, you fix all. We always provide literature and a written plan, which is usually an aha moment for most people. We educated this gentleman that cortisol recovers in deep sleep, and the NIH has shown that it's 8 hours, not 6 hours of sleep that's needed for full recovery of the adrenals, the immune system, and the metabolic system. We need 5 90-minute sleep cycles, which are continuous. So we never accept that I sleep 8 hours, but I wake up once. That's not acceptable. We talked about 8 hours restoring immune function and adrenal activity. Part 2 is anxiety equals depletion. So the fact that this man is having anxiety, is sitting probably on the red line, means that he's using more nutrients than he would on the blue line. So obviously, teaching him those mechanisms is important. No matter who your patient is and what they complain of, the very first thing we always correct is sleep and anxiety, because that automatically starts to recover the body, reduce the depletion. So when you have to choose one or two things, you're going to choose to address sleep and anxiety first. This will help you as you fill the fuel tank and clear the toxins. So we talked about heart-focused breath, getting in the tub, possibly using melatonin. In this gentleman, possibly using progesterone, magnesium at 6 to 8 grams, and omega. Magnesium ends up being a critical part of fixing low energy, because I have not seen a single person who is not deficient in magnesium, because the nervous system uses magnesium first. And when you have a nervous system that's firing, you're using magnesium. Look at all the little red circles. They're all magnesium. I use this magnesium. I used to use magnesium glycinate alone, and I got very good results. I actually felt like magnesium, when I added it to my practice about 5 or 6 years ago, basically made a huge difference in the recovery of the patients. And the glycinate is the water-soluble form. But I found the real power came when I added acetyltaurinate to the picture at 50 milligrams, which ended up being the lipid-soluble form, which actually affects the nervous system, which is what you want. Magnesium is critical, so we always load with oral magnesium in every single patient until they hit the point of diarrhea. And then we use transdermal magnesium, which doesn't have the gastric side effects, and we recommend Epsom salt baths with 5 to 8 cups of Epsom salt, which again is for the magnesium. The more magnesium you load, the easier it is for you to recover. The second supplement we always recommend is omega-3, because it lowers anxiety. This is a randomized controlled trial. And I always use the enteric coated one because it's absorbed 2 to 3 times better. And if you look at the MD Prescriptives one, it is 1 gram. But because it is enteric coated, it is absorbed into the RBC like 2.5 to 3 grams, according to the New England Journal of Medicine study. So this is why I generally recommend 2 of these a day. The third piece is that he's going to have to make himself the center of his own universe, soaking in the sun, being breath aware, choosing mechanisms like heart math and Tai Chi and Qigong and mindfulness-based stress reduction. This is a critical part of his program for the first 12 weeks to uncommit time and use the mechanism we talked about. It actually also improves the DHEAS and the cortisol levels, which is critical. We asked him to use imagery to reprogram his subconscious from I am anxious to I am calm, from I have no sex drive to I am sexual, it's returning, I have no energy to I am vibrant, I am relaxed, I am not anxious. So imagery is important, and we ask them to think about and to do what they really love to do. Very critical part of this thing, knowing that you're supported, knowing that you're renewed, knowing that you're uplifted. So using a mechanism that we've talked about with some magnesium, some omega, and some melatonin, we're already sleeping 6 to 8 hours, and we have had no panic attacks at week 4. Energy is slightly better. This is also when we managed to get some labs and realized that this gentleman's testosterone was very low. His free T3 was very low, all things we could have guessed. TSH was up. DHEAS was very low, 68. It should have been above 300. So exactly as we said, he has an adrenal, thyroid, sex hormone, triangular pattern. We were expecting the DHEAS to be above 2 to 300. So we started him on DHEA, 50 milligrams, some HCG, 250 international units, Monday, Wednesday, Friday. Immediately started him on some slow release physiological thyroid. Why slow release? Because he has anxiety. When he gets over that, we're going to be able to use a normal intermediate thyroid like Westroid or Naturetroid that are more pure, or Armour thyroid. So again, you can see we're aiming for sleep and anxiety. We really made sure that he was on magnesium RX and RX Omega and added Essentials 5-in-1 at this point. Essentials 5-in-1 is critical because it starts to activate the thyroid immediately. You're always looking for something with no dyes, no preservatives, no fillers, no FedEx because they radiate. Vacuum sealed instead of heat sealed. You're looking for normal biological forms like a B12, methylated B12, zinc at 50 milligrams, selenium at 400. These are important doses, iodine at 1,000 micrograms. I've always found that the reason why this is called 5-in-1 is because it allows me to take 5 bottles and really put it in one. I don't have to give you an extra B12, an extra zinc, an extra selenium. And the less bottles they walk out the door with, the better. So every patient gets on essentials. The delayed release is used for people with gastric issues. So I always use that in patients with gastric issues. And when they get to the maintenance phase, there are just those patients who are going to say, well, I can take 2 in the morning at breakfast and 2 in the morning at lunch, but when it gets to lunchtime, I forget. So for those people, they need just 2. And instead of telling them to cut down the essentials to 2, I switch them to daily 2 because daily 2 at least maintains the full dose of iodine, 35 milligrams of zinc, which is better than 25 in half the dose, and selenium 400 micrograms, and it maintains all the other doses at a good point too. It also has an enzyme blend in it, which is useful. So a lot of maintenance patients end up on the daily 2 regimen, and this patient at 10 weeks on the additional essentials, thyroid, and HCG ended up having good sleep. Energy was an 8. Panic, anxiety is 1 to 2, and this is on physiological slow-release thyroid. Sexual function is now an 8. This is excellent. What do the labs look like? Testosterone's up. This is on HCG. Do you need to keep him on HCG? Absolutely not. You're going to be able to wean this guy off HCG if he wants. Thyroid is a bit better. DHEAS is a bit better. Of course, he's taking it. I usually ask people to stop it for 2 days before we measure. And I think he's feeling kind of good. As you noticed, we went after sleep and anxiety first, and then went to energy. I'm going to quickly go through one more case before I wrap up this webinar. This is a 42-year-old attorney, JG, not working, exposed to dry cleaning agents in water as a child, diagnosed with fibromyalgia for 2 years, irregular periods. You're already starting to see the adrenal and the thyroid pathway in the irregular periods. She's 42. Her energy level is tanked. Her pain is a 5 to an 8. She's on anxiety meds, but she's really having panic attacks a couple times a month. She came in from the emergency room. She's on drugs for sleep, but sleeping only 2-hour stretches. With 2-hour stretch sleep, you have no way to fix that adrenal. You have no way to recover the immune system. And we know from this we're going to go to anxiety and sleep first. Some of the background, in addition to the toxic background she also had terrible stress for the last 4 years. The causes will end up being adrenal, thyroid, and sex hormones, as we talked about. The mindset that she's chronically ill and in pain. Nutritional depletion of magnesium, B vitamins, hydration, minerals, and toxic exposures. Are you going to go to the toxic exposures first? No. You're going to reprogram the mind, reduce the body and mental and physical stressors, and fill the tank. Once she starts to feel better and you're flushing with water, you'll see what's left of the toxins. They're always provided literature and given a plan, which is an aha moment. And while we're awaiting the serum labs, we start to work on the same program that we worked on with the gentleman before, of 12 weeks of full commitment to the self and uncommitting oneself from anything that lowers the vibration. Using reprogramming imagery and words from I am sick to I am happy, I am getting well, I am getting healthy, I am working and dancing better, I am getting healthy and productive. We're reprogramming that subconscious tune to I can have my best life ever, I will be full of energy and stamina, and I can sleep. This part of our program came late in my practice. Actually, this part was introduced only 3 years ago. And I hit this part in the program of the mind and the subconscious tune when I myself ended up having an adrenal issue. And what I found after adding this to the practice is that percentage of patients that we weren't able to get fully well are now getting fully well because they don't have anything in their subconscious that's keeping them from getting completely well. I can sleep. My chronic pain is going away. Committing to that which brings joy. Being more mindful because it stops the depletion of hormones and nutrients. Literally taking time to stop and smell and feel the roses, bringing all senses to one thing. This is Orlando Health's Cancer Center's Mindfulness Labyrinth. Walking, noticing the feel of your feet on the ground, the smell and the feel in the air, all senses to one thing. Keeping the heart rate under 120, drinking the adrenal aid, this is the big drink, 92 mineral pink salt, coconut water or pure water, vitamin C and lemon, possibly ribose, possibly a pinch of baking soda. This is what I give all my athletes, and they all do very well. Taking a nap from 1 to 3 p.m. So, of course, all these simple things. And I tell patients, yeah, I have my MD, but what am I telling you to do? Go out in nature, get some sun, breathe, sleep, eat, drink. Really didn't need a degree to do that, did I? Immerse yourself in pure joy. And now what? Hormones. We're going to give her progesterone, 25 milligrams to start with, and tell her to keep going up. Take it 1 hour before bedtime, slow release in a capsule. Go from 25 to 50 to 75 and keep going up until you're sleeping and your anxiety is completely gone. Nutritionally, no surprises here. Magnesium, 6 to 8 grams. Essentials 5-in-1, I'm using the delayed release in her case because she reports toxins and I don't want her to have gastric issues. RX Omega, 6 to 8 grams. And in her case, because she is so depleted, we are giving and offering IV Myers, vitamin C, and IMB12. These will be temporary. This is the role for IV nutrition is when people are very sick. By week 4, this patient on this regimen of progesterone and some magnesium oil and magnesium, you notice she couldn't really tolerate oral magnesium well. Thank God we didn't give her regular essentials. Drinking the adrenal aid, taking mindful time. Stress is a little lower. Sleep is a little better, 5 hours instead of 1 to 2. Energy is a little better. Anxiety, way better. No panic attacks, and she's on progesterone 225 milligrams slow release. And the pain is a little better. And of course, anytime you put progesterone and magnesium and omega, you're handling inflammation right there. Her levels come back at week 4. She has no progesterone, almost no cortisol in the morning. You would expect a cortisol response with a blood draw. Undetectable DHEAS, almost undetectable pregnenolone, very low free T3, and in her case we did have a 4-point salivary pattern which basically showed no cortisol all day long. So she's actually a candidate for cortisol. Her anxiety and sleep are better, so you can actually go for energy. In her case, we added DHEA, and in her case, we added a little bit of cortisol. You can do a routine of 7.5 in the morning, then 5 at noon, and 2.5 in the afternoon, or 5, 5, and 5. I really let my patients play with it until they find something that works for them. We measured nutrition in her case. I used the SpectraCell intercellular function. All the B's were low, the magnesium was low, all stuff that we had guessed would be the case. We added some adrenal support, and it's funny because when I got into this field, I always thought that ashwagandha and rhodiola were the big ones, but what I have found is the cordyceps, along with the rhodiola and pansang ginseng, end up being a very important combination. And ever since I started using the Adrenal Forte, which I formulated, I really have found that to work better than many of the products because you only need 4 capsules. And I usually suggest 2 at breakfast and 2 at lunch. And some people take 4 at breakfast and 2 at lunch. And if they can't take the lunch one again, take it just all in the morning. By week 8 on this particular set of things, including 20 milligrams of cortisol and the progesterone's higher, we haven't really started any thyroid yet, but the anxiety is now very, very low. So we have the opportunity to start the thyroid. That's exactly what we do. In her case, because anxiety is low, we can start intermediate release Armour thyroid, or my preference is Westhroid, 15 milligrams, and tell her to go up every single week. By 4 months, she has started on light exercise. She's on Armour 90 milligrams. All of her symptoms are pretty much resolved. Zero pain, zero pain. Pretty powerful, right? And her results show that her progesterone's better, her DHEAS is better, it's 90. We really wanted a little higher than that. Her B vitamins are better. We do a weekly follow-up on the exercises of reprogramming to being happy, vibrant, healthy, and productive. And at this point, at 4 to 5 months, we're able to start weaning the cortisol. And if we want to go to detox, we start with monitoring pH, plant-based, possibly monitoring, looking for heavy metals and other things. But this is the time to do it, not when we start it. We keep this up for 6 months. I usually keep people, and you can see she's off the cortisol now, but I keep people on Adrenal Forte for the whole time. And you can see this is a very reasonable regimen for somebody to keep up on. It's not 100 things. Magnesium Essentials RX Omega. That's the powerhouse. That's what I use in every patient. That's what I keep every patient on. If they have adrenal issue, I keep them on Adrenal Forte for 6 months, maybe even 12, depending upon how they're doing. I've already gone through this, but the thing to realize here is so every patient's on essentials, every patient's on some magnesium, every patient's on some omega. Why do we have to keep patients on magnesium? Simply because the magnesium lowers the nervous system stimulation, which now is a given part of our daily lives. Adrenal Forte is the last one. I put most patients on this. This is not something I keep everybody on. What you'll notice is the more pills you put people on, the more they'll come off of things. So at 6 months, the take-home notes are anxiety equals depression. Fix anxiety first to slow down depletion of the fuel tank. So fix it with heart math, magnesium, progesterone, omega-3, and shedding of unnecessary commitment. Naps are good. Aim for sleep 8 hours. Look for low steroid hormones. Once anxiety is better, start the thyroid. Once energy is better, go for toxins. I ask you, as physicians, to reprogram your self-talk from I'm tired or anxious or will my practice thrive, what does life look like, to I'm energized, abundant, optimistic. And with that, I want to share with you that all of the supplements I mentioned, except for Adrenal Forte, are 10% off for the month of November. And I hope that you continue to have your best life in front of you and enjoyed this webinar and educational series. I will take a few questions at this point. Why did we use Essentials delayed release in the second patient? I mentioned that this was because this patient had a history of toxins, and delayed release is better on the gastric system. Next, when do you use Daily 2? I use Daily 2 in my patients who tell me, you know, I really can't get the second dose of Essentials in at lunchtime. So instead of cutting Essentials down to 2 capsules, which will also cut the zinc, the selenium, and the iodine down, I switched them to Daily 2, because Daily 2 happens to be a good maintenance, and you can just take 2 in the morning and have the 400 of selenium and iodine. So all the minerals are pretty much kept at the higher dose. Would you ever increase thyroid action with T3 alone? Yes. I use Cytomel quite frequently. That I use when patients' anxiety is good, their magnesium is good, and if I need to keep going. So for example, in that second patient who I had on Armour at 90, if her energy level wasn't perfect, I would have added some Cytomel. What about iodine? Iodine maintenance, 1 milligram, already in Essentials, already in Daily 2. But there are those patients who are going to need more iodine. For example, patients who have any kind of cysts, polycystic ovaries, fibrocystic breasts, any kind of cancers. You could make the argument that the maintenance dose should be 2 to 3 milligrams, and there are those people who use up to 12.5, but I would suggest that if you use those higher doses, that at some point you do the 24-hour loading iodine test. How does magnesium ATA compare with threonate, glycinate, and orotate? The ATA is lipid soluble, which means it works through the blood-brain barrier, very well proven to decrease restless leg syndrome, migraines, epileptic seizures. Glycinate is water soluble. Threonate and orotate are also lipid soluble, but they are more expensive. I like the MD Prescriptives formula because it has a combination and it's affordable, so I generally use that combo. Next question, how does the cost of RX Omega compare with the Costco brand? It basically beats the Costco brand in cost, interestingly, simply because it's enteric coated and its absorption is much better. Where can I find out more about HeartMath? If you go to heartmath.org, you can see they also have apps that people can use. This comes to the conclusion of this webinar. Truly appreciate you for following these webinars, and let me know if there's anything I can do with and for you so that you have the best in your life in front of you. Thank you very much, and that is the end of this particular broadcast.